We often get asked the same questions about teeth straightening and whitening, and here we are going to address some of the answers with Dr. Alok, our CEO. Some other people have asked if they are disqualified for clear aligner therapy if they have a missing tooth or multiple missing teeth.
So many people want to improve their smile. Straightening your teeth is an important part of it, but it may not be all that you require. You may need what is called a multidisciplinary approach. Basically what this means is you need some part of orthodontics for straightening, maybe some gum health treatment, maybe some prosthodontics to improve the shape and size of your teeth. So if you had a missing tooth, then you would need some prosthodontics to either have an implant or a denture or a bridge or something like this. But you wanted to have your teeth in the right position first before getting the tooth replaced. So with clear aligners, you could have a really safe and easy way to get your teeth straightened nicely, and then you could have the procedure done like the implant or the bridge or whatever your dentist recommended to then restore the missing tooth, and then now it's all in a nice arch form shape for you. Also with missing teeth, it depends which tooth is missing. If it's a tooth which is missing, let's say at the back, like a molar or a premolar tooth, you can make sure that you can maintain the space so it can be restored properly with the predicted movement. But if it was a tooth which some people are missing their side tooth, some people are missing like a premolar or something like this, and they're asking can that space be closed? In some situations it would be a good idea to close it, in others it wouldn't. So it all depends on the individual case, which is why it's so important to see your simulation and at the same time beforehand, describe what you actually want to achieve before you actually see your simulation. This way you can get an option which is right for you. In some situations, if you've got a missing tooth, such as say some premolars, and you were thinking, I don't want to have gaps, but I want my teeth straightened, it's possible sometimes to design the aligners with fake teeth inside them. So this means that when you are smiling, you're wearing the aligner, but it also looks like you've got those teeth in position. This means you can have your teeth straightened and you can still stay confident and ready for when it's the time to replace those teeth.
People have lots of questions also about their wisdom teeth, asking if they are going to make their teeth more crooked, if they are going to push them after treatment, so if they need to get them removed before getting started.
So with wisdom teeth, there's a few things to understand. First of all, they are singular teeth. So if they're in like your lower arch, you have maybe two at the back, and then you have all the other tooth roots at the front in front of it. Two teeth don't have the force to be able to move all the other teeth. So it's a bit of a myth that those cause the crowding. Crowding is caused by the function of muscles like the tongue, the lips. These all are functions and forces on the teeth which make them move over time. So if you're asking, do I need to have your wisdom teeth taken out? They should only really be taken out for some really specific reasons. One reason would be that the wisdom tooth has some decay or an infection which cannot be treated and needs to be removed. So that's one thing. The second thing is if the wisdom tooth is causing decay on the tooth in front of it because you can't clean properly. Again, another reason to remove the wisdom tooth. And another one would be if you've had 2 or more episodes of infection from that tooth, then that needs to be removed. But if you've just got a wisdom tooth and it's not infected, it's not decayed, it's not causing any problems, then you probably don't need to have it removed. And it should be checked with your dentist and x-rayed regularly to make sure it's right for you, but you shouldn't be worried. Wisdom teeth are actually missing in many people. Some people don't have any. I don't have any wisdom teeth at all naturally. So some people have them, some people don't have them, but I wouldn't be too concerned unless there are some very specific criteria.
Thank you so much for all the insights that I'm sure you found very useful too. And if there's anything else you'd like to find out about teeth straightening or whitening, please write your comment in the comment box below and we'll make sure to address them in the next videos. Thank you so much for watching. Hope to see you soon on Straight Teeth TV and straightteethdirect.com.